Qatar was recently ranked as one of the top countries for research on diabetic neuropathy. Qatar Living spoke to the man behind this achievement, Dr. Rayaz Malik.
One, investment from on high through a number of bodies. It used to be the QNRF, now the QRDI. And a genuine, I think, philosophy and belief that by investing in health, in education, we can improve things. And the other, of course, aspect of it is that diabetes is a big issue in this part of the world. You know, some of the highest prevalence in the world are in the Gulf region, particularly in Qatar. So I think the government has recognized that, and they've invested over the last 20-25 years into actually medical facilities to improve things, but also the research. You know, and that's actually ultimately, you know, it's about education, it's about innovation, it's about research, it's about clinical care. And Cornell is a prime example of that, that we believe in all those aspects, and that's driven what we have now achieved in terms of success. So honestly, alhamdulillah, you know, I was brought in from Manchester, UK, 10 years ago by Cornell to develop a clinical research program. I was already established in the field of diabetes and its complications, and particularly diabetes and neuropathy. But I was relatively junior then, but I've had the scope, I've had the support of Cornell, of Hamad Hospital, of Sidra Medicine actually, to enable us to do cutting edge research, not just doing research like, you know, gathering a little bit of data here and there. Really, we are at the, you know, we're leading in terms of the innovation, understanding why nerve damage occurs in diabetes, what treatments we might be able to give, really developing the latest diagnostic technologies in Qatar, and leading. Okay, so diabetes, if you get diabetes, you develop what's called the complications of diabetes because of the high glucose washing every single tissue in your body. Neuropathy? Well, neuropathy means damage to nerves. What are nerves? Well, nerves are found in your periphery, in your brain. And you can imagine, if you haven't got nerves in your brain, you ain't going to do very much. And if you haven't got nerves in your periphery, you aren't going to do very much. In that, what do? They carry signals from the rest of the body to your brain to tell you what, you know, what you're doing, whether or not you picked up something hot. It gives you sensation. When I pick up a pen and I use it, if I'm numb, I won't be able to pick this up. I will have no idea what to do. So it carries sensation, but also in almost a perverse way, when they get damaged, they actually carry pain signals. And they carry pain signals anyway, but they carry extra pain signals. So the typical patient with diabetic neuropathy will get, on the one hand, pain, debilitating pain. They feel hot, they feel pins and needles, they feel lancinating pains in their feet, can't sleep at night. And on the other hand, they can actually lose sensation completely, such that they will develop ulcers in their feet, and they will be aware of it. Yeah, so this honestly is a great story to be told over a coffee, but the bottom line is, this is an instrument that ophthalmologists initially kind of used in the world of ophthalmology on optometry 20 odd years ago. And when I was in Manchester, actually just happened to be talking to somebody who was an optometrist who said to me, Rayaz, you know, what do you think? Could we maybe look at use this instrument that scans the front of the eye, the cornea, right? And you think, what's the relevance of that? Well, it happens that the cornea is the most densely innervated tissue in the body. And a simple way of appreciating that is, if I do this, I kind of feel that. If I do that, how painful is it, right? So there are all these nerve fibers. Now, the trick is in being able to image these nerve fibers. Now, if I want to understand neuropathy before this corneal confocal microscopy came along, I would have to actually take a piece of skin, send it to the lab and have a look at the nerve fibers. The amazing thing about corneal confocal microscopy is that if I can actually just touch the front of the cornea and it can scan, and immediately it gives me images of the nerve fibers. And we started this work like 20 plus years ago, actually, in Manchester, where we took people with diabetes. We looked at those with and without neuropathy, and we were able to show that scanning the eye, you actually showed loss of nerve fibers. And then, as you do, when I came here, and no, I wasn't bored, but I met other people who said, well, Rayaz, the cornea's up here. What about diseases of the brain? Right? And honestly, this is where in Qatar we've led in terms of establishing that less nerve fibers here actually are related to people with dementia. So I've worked with the Qatar geriatrics unit in Hamad with Dr. Anadi, and we've shown that people who have got dementia have less nerve fibers. Furthermore, the big worry always is you have somebody who's got mild cognitive impairments. They're not quite, haven't got dementia yet, but they could get dementia. We know 30% of them do. Can we predict from doing a scan whether somebody will get dementia? Yes, we've shown that. And we've done it for diabetes as well. Actually, diabetic neuropathy, people who've got absolutely nothing wrong with them at the moment. You scan them now, and then 5 years later, a proportion develop neuropathy. And what we show is that if you have less nerve fibers, they're the ones who are going to get neuropathy. So that in a way is like, it's an eye scan that tells you about these multiple neurodegenerative diseases. So dementia, multiple sclerosis, Parkinson's disease. We've even done it in people with stroke, and multiple peripheral neuropathies. Yes, in my clinic, yes, I get a lot of patients referred to me as well, with kind of like funny kind of symptoms. Have they got peripheral neuropathy? Have they got something else going on? We have got ongoing studies actually, again, funded by Qatar Foundation. They had the wherefore to think, what? This sounds like a crazy idea, right? How on earth can you do this? But, they did invest a large amount of money for us to develop this, the whole kind of story of how, imagine scanning the cornea, and I always say, the eye is the window to the soul, right? And the eye is a window, honestly, to multiple neurodegenerative diseases. But one of the key factors probably that is limiting at the moment is the availability of these instruments, because they're kind of a bit niche. So there is a supply problem. And I honestly believe that, again, in Qatar, we could actually build a brand new one of these corneal confocal microscopes, and then we would be the guys who would supply the rest of the world. The most what we call neurodegenerative diseases, the problem is that because of the tests we have currently available, they diagnose the disease too late. And even when people who've got dementia, now actually we have got some new treatments coming through, right? But for a long time we had no treatments, and for diabetic neuropathy we have no treatments that modify the disease. Part of that reason is because we're diagnosing the disease too late. So here comes corneal confocal microscopy, right? I can actually pick up early nerve damage. Literally, we found it in children with type 1 diabetes, in people who are just overweight, in people who will develop clinical diabetic neuropathy with the problems maybe 10 years later. So that's an early diagnostic. So that's one thing. The other thing I could do, and I had a clinic this morning, I've got patients who will say, yes, doc, I've got a bit of diabetes. And then when I scan their eye, I find they've actually got nerve damage. When I show them the picture of these less nerve fibers, it's so motivating for them to say, oh my God, something's happening. I need to do something. And of course, we can improve their blood sugar. We can give them certain medications to help repair those nerves. And one particular drug that everybody talks about right now is the Ozempic or the Mounjaro, right? Actually, there is now compelling data coming through, showing that those therapies, not only do they help people lose weight and improve diabetes, but they actually repair nerves. And so we're actually doing studies now. Again, we're at the forefront, nobody else has done these studies, and we're actually showing, using corneal confocal microscopy, that when you treat drugs like this, you can repair the nerves. Honestly, if there were enough of these microscopes around, I would recommend at diagnosis, and even in people who are overweight, who are pre-diabetic, we've shown that if So it's a long journey to getting diabetes, type 2 diabetes. So you have people who are, okay, well, in their 20s. Then about their 30s, they start getting a phase called impaired glucose tolerance, which is like, it's not really diabetes and it's not really normal. And we kind of, as physicians, we just kind of say, okay, we'll just wait until they get diabetes. And then we start to do something. I would say that even in the pre-diabetes stage, people should be having a scan. And if they've got an abnormality, we need to then be treating those patients to stop them from going on to develop diabetes even. And even if they've got early type 2 diabetes, we now have, within our power actually, wasn't the case 3-4 years ago. 3-4 years ago, all we used to do is give therapies, drugs, even insulin, to lower the blood sugar. Could we cure type 2 diabetes? No, we can now. With the likes of Ozempic, with the likes of Mounjaro, actually, I have patients now who've come to me with early type 2 diabetes. I put them on these medications. They lose a huge amount of weight and they cure their diabetes. And that's a game changer, because it now empowers me and empowers the patient to believe that, you know, look, I've got diabetes and it's like used to be a life sentence. That's it. You've got diabetes, deal with it, right? All you're going to do is, as a physician, all I'm going to do is I'm going to put them on another drug. I'm going to put them on insulin. It's a horrible existence. And now I can actually say to them, look, you know what? If I can get you to lose a certain amount of weight with these particular therapies, we can cure your diabetes. And I'm doing it right now. I'm actually curing people with that, and it's great. You know, once you've got diabetes, type 2, especially if you're on insulin, it's too late. You know, you need to just carry on being treated with these medications. But I have got patients who were on insulin, who then have gone on to GLP-1 therapy or these kind of therapies. And when they've lost weight, their diabetes has been cured. And the power example of curing type 2 diabetes actually didn't come from the Ozempics and the Mounjaros of this world. Actually, it came from bariatric surgery, where we know that if you are overweight, you have diabetes, I perform bariatric surgery on you, 70% of people, their diabetes will disappear, at least. And that's just because type 2 diabetes actually is quite complicated. There's not all, we all say, oh, it's type 2 diabetes. There's actually probably about 5 different variants in there. And there's that 1/3 that don't get cured, or 30% that don't get cured. They have a different type of type 2 diabetes. Yes, in the right group of patients. So people who are morbidly obese, yes, absolutely. People who've got diabetes, for example, people, you know, I know we kind of think, oh, why am I going to have surgery and it's terrible and it's all these complications. But I always say to people, patients, balance it up. You've got a lifetime of being overweight, having diabetes, having hypertension, being depressed, or actually, you know what? You have bariatric surgery, and honestly, you can, it literally it's a new chapter you could open. You can get rid of all these diseases and you are fit and healthy. Yes, we say there are maybe complications, you know, like malabsorption of certain vitamins, but you deal with that.